Welcome to Aboriginal Head Start on Reserve's virtual recording on the Restart Planning Toolkit. This webinar is being recorded on August 10th, 2020. All information is current as of this date. Before we get started, we would like to take a moment and leave some space for you to individually acknowledge the traditional territory where you are watching this webinar recording.
Since COVID-19, we are all delivering our work in a new way. This is one example. We have developed this presentation to assist you in the process. We believe in healthy, self-determining, and vibrant First Nations children, families, and communities. This is the Head Start team who developed this resource. At the end of this presentation, you will find the contact information for each advisor. Your regional Head Start advisor is here to support you and your community as you proceed.
In the first half of this webinar, we are reviewing the information and resources available to you as you restart your Head Start program. In the second half of this webinar, we discuss the different delivery models available and specifically focus on two models that are well positioned to support you to deliver programs during this time of physical distancing. So what have we learned about this novel coronavirus, or COVID-19 as it's also known? We've actually learned a lot compared to what we knew back in March when the majority of our programs were closed. At the end of June, Dr. Shannon McDonald and Dr. Bonnie Henry released data and reported on cases of COVID-19 within First Nations communities and Indigenous peoples in BC during the period from January 1st to June 14th, 2020. During this time, for children from birth to 10 years old, there were no known cases. In general, we know COVID-19 has a very low infection rate in children. In BC, less than 1% of children tested have been COVID-19 positive, and even fewer are suspected to have been infected. Most children are not at high risk for COVID-19 infection. Children under 10 have a smaller proportion of the total confirmed child cases compared to children between the ages of 10 and 19 years. Children under the age of 1 and those who are immune compromised or have pre-existing pulmonary conditions are at a higher risk of more severe illness from COVID-19. Children who are at higher risk of severe illness from COVID-19 can still receive in-person instruction. Parents and caregivers are encouraged to consult with their health care provider to determine their child's level of risk. Based on published literature to date, the majority of the cases in children are the result of household transmission by droplet spread from a symptomatic adult family member with COVID-19. Even in family clusters, adults appear to be the primary drivers of transmission. Children typically have much milder symptoms of COVID-19, if any. They often present with low-grade fever and a dry cough. FNHA has numerous resources for you to stay connected.
The following information is to assist our communities during this phase of the restart. For those of you who may be considering reopening programs or services during the COVID-19 pandemic, we're providing some important restart operational information and resources. This supportive information is community-based and community-paced to be used at your own stage of decision-making and stage of readiness. A high-level resource was provided to support the health directors, and a more in-depth resource was provided to support the Head Start coordinators and can be found on our Head Start website page.
FNHA has developed a number of resources to support communities during this pandemic for community leaders, frontline staff, and individuals. We launched a services resumption planning guide on June 1st. This guide speaks to the necessary policies to manage the workplace. For example, on page 31, you'll find a section on developing policies. Be prepared that you may be asked by your licensing officer or others to provide feedback on your program and planning, such as cleaning and disinfecting, illness, and hand washing. Your health director or leadership received a copy of this resource, and if you would like to become more familiar with this document, there's a link at the end of this presentation, and you can also find it on the FNHA website. A guide to COVID-19, caring for yourself and your loved ones. This document was also released on June 1st. You will find information on prevention and protection, symptoms and testing, and a map of the 86 collection centers where a person can be assessed and tested for COVID-19. On June 19th, we released Community COVID-19 Safety, a planning guide. This is a supplemental resource to the Services Resumption Guide. The three main areas discussed in this resource are community assessment, community safety action plan, and job hazard assessment. On pages 21 to 25, please review the child care standards and guidelines. This section will review the policies you'll need to update, such as when staff and children should stay at home, a communication plan, how you will collaborate and hold ongoing discussions with your community leaders, health directors, and other partners. Pick up and drop off policies and procedures. WorkSafe BC recommends this should occur outside when possible at a designated area. Hand hygiene and respiratory etiquette, physical distancing, cleaning and disinfection, meals and snacks, and other methods you can implement to control risks. Head Start advisors have developed and sent out a number of resources to support the programs. We'll review a few of these resources during our presentation. The intent of the resources we developed are to support your program, provide some points to consider, and perhaps adjust your service delivery model to meet the current needs of your community. We are all adjusting to doing our work in a new way. We acknowledge this takes time to plan with your leaders, staff, parents, and then to roll out a program that meets the new health guidelines and wise practices. We are here to support you through this process.
There is so much information out there to support you. We would like to highlight some foundational resources. The first resource we are highlighting is the Public Health Guidelines for Child Care Settings, updated July 29, 2020. Please, please, please familiarize yourself with the contents of this resource. These guidelines are one of the most important documents to be familiar with for Head Start because it's all about best practices, and we encourage everyone to refer back to this important resource. This resource details how to prevent the transmission of COVID-19 and maintain a safe and healthy environment for children and staff during this pandemic. It was co-developed by the Ministry of Health and the BC Centre for Disease Control. In the latest update, the Public Health Guidelines, they've updated their information on COVID-19 in schools. There's a limited evidence of confirmed transmission within school settings. This is partially due to widespread school closures worldwide at the onset of the pandemic to help prevent the spread of COVID-19. In documented cases, there was typically minimal spread beyond the index case, though through isolated outbreaks, and have been reported. Children do not appear to be the primary drivers of COVID-19 spread in schools or in community settings. Schools and childcare facility closures have significant negative mental health and socioeconomic impacts on vulnerable children. Prevention measures and mitigation strategies involving children must start with risk assessment. This information from the BC Centre for Disease Control is based on the best evidence currently available. It will be updated as new information becomes available. It's important to stay current on the latest information and research as it evolves. The Ministry of Health has also helpful resources located on their website titled Children, Youth, and Families During COVID-19, updated July 21st, 2020. We will provide you with the links at the end of this presentation. Work with your licensing officer, along with posting the necessary COVID-19 safety plans that outline your policies, guidelines, and procedures that reduce the risk of transmission. This will be required by your regional licensing office. For example, you may post the COVID-19 safety plans throughout your center and on your community or Head Start program website. You will hear this from us more than once during this presentation. It's important to keep updated on the latest information as new research and information becomes available all the time. We're here to support you in the information gathering, and you're not alone. One of the resources found on the BC Centre for Disease Control website under Frequently Asked Questions in Assessing Risk states, children are at a low risk of catching and spreading COVID-19. In BC, children have had a much lower rate of COVID-19 infection than adults. Children who have developed COVID-19 have most likely required it from adults in the household setting. COVID-19 is more likely to spread between adults than among children. Ensuring you follow public health prevention strategies such as frequent and thorough hand washing, avoid touching your face, staying home when sick, and avoiding direct physical contact, maintaining physical distancing, can reduce the risk of COVID-19 for everyone. WorkSafe BC is the place you and your team will need to learn about in order to develop safety plans, understanding the risks, selecting protocols for your workplace, and additional resources and information. They also have a helpful checklist resource. One of the messages WorkSafe BC states is, employers must involve frontline workers, joint health and safety committees, and supervisors in identifying protocols for their workplace. It's necessary for staff to be involved in these new protocols so everyone is on the same page and all of the staff know what their roles and responsibilities are in this new world we now live in. Please note, employers are not required to submit plans to WorkSafe BC for approval, but in accordance with the order of the Provincial Health Officer. This plan must be posted at the work site and on your website if you have one.
Here are some additional external resources. The resources that we've recommended have valuable information for all staff to be aware of. BC Centre for Disease Control website. This is where you'll find resources on cleaning and disinfecting for public settings. They also have childcare safety guidance for parents, which outlines the risk of COVID-19 for young children. Public health principles for childcare operators and staff. This resource reviews steps to take when someone is sick, role modeling physical distancing, cleaning high-touch surface areas, and proper hand hygiene. The frequently asked questions will assist you to answer any questions your staff or parents may have. BC Aboriginal Childcare Society has a number of helpful childcare templates staff can review and adapt with their team when developing the newly required policies and procedures. Please take some time to check out the instructions on how to use the templates, the welcome back sample letter, and the policies such as health, drop-off and pickup, how to manage visitors to the program, and cleaning policies and schedule. BCX recently announced emergency COVID-19 funding from June 1st to September 30th. Communities whose programs are operational may be eligible to apply for up to $10,000 to support your program for any additional costs your program may require to deal with COVID during this 3-month period.
Again, we are highlighting the importance of ongoing discussions and planning with your community as information becomes readily available. There may already be discussions held by your leadership as they review the FNHA Resumption Planning Guide. Other restart planning tips to consider. Head Start operations and staffing. Once you have thoroughly read through the above dialogue with your multidisciplinary teams, including community leadership, there are some other things to consider. Hold ongoing discussions with your Head Start staff to inform and support the process of planning for the restart. Keep updated on the latest information, such as the BC Centre for Disease Control. As information becomes readily available, consider how you will ensure staff are kept up to date on an ongoing basis, along with equipping them with the knowledge to implement the necessary changes. Consider how will you support your team in understanding how and the why, along with the ability to support best practices. The what. What is your communication plan? What additional training will the staff need to take? Take time to support the staff as they adapt to the new best practices. This will ensure families and the community are receiving the highest operational standards and quality assurances. We have experienced that COVID affects more than our physical well-being. With so much happening, it's normal to feel worried and overwhelmed. Mental wellness, particularly stress, also impacts our physical well-being and our behaviors and can increase our risk of getting sick. It's important to focus on your own, as well as children and other staff members' mental well-being. Please access the necessary resources to support your staff team. Each individual may be experiencing various levels of emotional and may require additional supports. For example, some communities may have a health benefits plan, while others may stay connected with internal or external resources. Taking these necessary steps will support the transfer of knowledge and information from the staff to the parents, along with staff providing the ability to role model these best practices. These items could be a part of the staff's reorientation to the new policies and procedures. We want staff to ensure for all staff to be confident and supported in their new roles and/or responsibilities. Be prepared to adjust your approach to transitions. For example, how would you support pickup and drop off, or mealtime or napping time? Identify what may or may not be available and how you will proceed. Daily schedule. Anticipate what interruptions may occur and plan how to adhere to the above procedures.
It's important to monitor and evaluate your plans and adapt as needed. Identify what needs to be communicated in order to inform families prior to their return. For example, what are the hours of operation? What can families expect? What steps must be followed around drop-off and pickup times? How will your new protocols and policies support a safe return to the programs? Identify how families and your community will stay informed and supported. For example, posting your reopening date, what to expect while you restart. What may not be available? Will you offer resources to support awareness such as health and safety? If you previously offered and shared a family meal, will that be offered during this time? If not, what will your adaptations be to ensure a safe environment for all? Will you be offering a closed online Facebook group, offer a town hall meeting or videos on how your program will look? Consider how you can provide messaging to the families. We are all in this together, and how your program will support them. Post and share information such as how to physically distance, how to properly hand wash and hygiene, how to clean and disinfect, information on when to stay at home when you're not well, etc. Many of our communities have experienced the benefits of an outreach delivery model. Communities may want to consider how to continue this service.
Many communities recently experienced how flexible Head Start is when they shifted from their existing preschool delivery model into an outreach model. Staff working from home developed and distributed resource kits to the families in their communities. The beauty of Head Start is that it's a flexible program that can be adapted to meet the needs of your community. Head Start delivery models. Communities make different choices about how to best use their Head Start funds, taking into account their community size, numbers of children, existing services, and capacity. Isolation factors and transportation challenges, as well as family and community needs and priorities, and availability of qualified staff. Some communities use Head Start funds to supplement and enhance their existing programs and link with other funding sources, while others use funds to create programs where none existed before.
There are 4 common Head Start delivery models. The first one is the outreach and family program. This model works well for communities without a facility, enough children, and transportation challenges. For example, home visiting services and scheduled family activities, outdoor learning with families, parent and taught programs, community kitchens, toy or book lending libraries, or holding parent workshops. The second is the daycare and preschool enhancement. This model can enhance existing daycare or preschool, targeting gap areas and ensuring 6 components are included in programming. For example, additional ECE or language staff, outdoor learning, parent workshops, culture and language activities, offering nutritious meals, and outreach services. The third is the combination. This model is very flexible and works well in small communities where number of children, staff, and facilities are limited, to enhance or offer multiple services for children ages 0 to 6. For example, outdoor learning programs, language nests, before and after school care, parent and taught programs, outreach services, or even parent workshop programs. These programs can be short-term, like a summer program, ongoing, or a combination of both. The fourth model is the standalone. Center-based Head Start programs are licensed programs for children 0 to 6 years with qualified staff that meet licensing standards. For example, some communities are operating child care services to essential workers.
The last part of this webinar, we are highlighting both the outreach program as well as what it could look like if you operated a land-based program. We know the least risk for transmission of COVID-19 is to implement the Head Start outreach delivery model and land-based learning, because the BC Centre for Disease Control tells us exercise, play, and other activities should be done outdoors when possible. At the beginning of this pandemic, we developed 2 resources on outreach. The first was focused on implementing an outreach delivery model. In the first resource, we reviewed how to design and prepare for the program, how to develop procedures or policies such as handbooks, how to develop and prepare resource kits for families, and how to support and inform families. Another resource you will find helpful is the BC Early Learning Framework, or ELF. This is a robust resource, and we invite you to consider the opportunities it presents as you take a closer look at your learning space while weaving in the 6 components.
There are so many possibilities to developing outreach kits, along with offering outreach in your community. We have witnessed many adaptations over the years, along with how communities shifted to this delivery model through the pandemic. The following are a few examples. Delivering outreach packages with fun and interactive early learning activities to the family's home. Hosting virtual circle times or story times. Delivering kits with the contents for a movie night. Providing materials and interactive games to create bird houses while learning how to identify the birds in their community. Offering nutritious meals or the ingredients and recipes for the family to create their own meal. Create activity bags or for the various age groups. Share helpful resources such as proper hand washing tips. Providing nutritious meals. Going on a medicine walk and learning the names of the plants, foods, and medicines within your community. And provide linkages to other community supports.
Our newest resource, Exploring Your Program, Connections to Land-Based Learning, will support your community on how you could implement this type of program. The professionals and guidelines repeatedly tell us to have children outside often, including for learning activities, snack time, and playtime. As Dr. Bonnie Henry says, fewer faces, bigger spaces. First Nations people are known as keepers of the land. For many years, we have witnessed communities gather and develop curriculum with knowledge holders, elders, traditional healers, community members, and parents to participate in experiential learning during the planning process, providing the opportunities to offer or seek other protocols, teachings for consideration, such as offerings and prayers. In this resource, the first in its series, Exploring Your Program, Connections to Land-Based Learning, we highlight these topics for your review: getting started, administration, budgeting, staffing, planning, training, hours of operation, schedules, materials, building curriculum, and incorporating the 6 key components, and of course, community involvement.
We mentioned earlier that the BC Aboriginal Childcare Society announced the emergency COVID-19 funding. This may be a time for you to consider what you may need to offer outdoor learning program. For example, startup funding, such as materials and supplies to build or construct a shelter. This is a wonderful opportunity to engage your community. Find out what their talents and ask for their help. We suggest that you follow your community's protocol while promoting awareness, inclusion, and belonging.
We have witnessed many communities weave their relationship of our land-based healing and teachings into their Head Start program. These are examples of how we can easily include the 6 key components. As the child is the learner, we have observed the importance of meeting them where they're at. It's about the process, not the outcome. It's about building the child's confidence as they learn through play in their natural environment. Land-based learning has endless possibilities. Outdoor play supports our respect and connection to the land, which is important for our mind, body, and spiritual well-being. There are many benefits and life skills to be learned through risky play. Some of those include fostering problem solving, building resiliency and persistence, understanding consequences to action, and developing curiosity and wonder.
Regional Head Start training themes can be offered either in person or virtual. These are quite flexible and can be tailored to your individual needs within your program, staff, and community. Please visit our website or connect with your regional Head Start advisor for further support and information on this menu.
Throughout this presentation, we have referred to numerous resources. Here is the list of websites we have referenced, and these are included in the participation handout notes.
You may have further questions after watching this recording. Here's the contact information for the Regional Head Start advisors, which can be found on our website.
In final, we would like to offer our gratitude for sharing this presentation and look forward to supporting you as you proceed. We are in this together and we are here for you. We would like to end this webinar with one of Dr. Bonnie Henry's well-known quotes: "Be kind, be calm, be safe, sharing all our relations."